Hello, and welcome to Forte Sports Medicine Orthopedics, the total joint replacement for your knee. This is the preoperative education PowerPoint presentation. So there are many things to think about in order to get ready for surgery. So if you live alone, it is very important to have somebody stay with you for at least 5 to 7 days to help you around the house at night, and then to be there especially at night in case there's an issue. Try to think ahead, prepare ahead of time, try to prepare meals ahead of time, get all your ducks in a row, so to speak. You're not going to be able to be up doing basic household chores and cooking meals for about 3, maybe 4 weeks on a bigger basis. And then you may not be driving yet in order to get to your outpatient physical therapy appointment. So please arrange for somebody to bring you. Some other preparation to consider are things to help reduce the risk of falls during a recovery. Please keep your pathways and your hallways clear of objects, debris, and pets. Pick up the throw rugs by the sinks and the toilets, as they are tripping hazards with assistive devices. Those rugs can come back down once you are walking normally without your assisted devices. Consider adding grab bars in your toilets and showers to help you safely stand and sit, and also to come in and out of the showers. The suction cup type grab bars that you can find at most hardware stores oftentimes work really well to be temporary grab bars without having to drill anything into your wall. Pet care is very important. Please arrange for somebody to help feed and care for your pets. If you have a dog that needs to be walked, please arrange for somebody to do that, as we do not want you walking the dog for maybe up to 8 weeks, but a minimum of 6 weeks. That if the dog pulls on your leash, you can potentially fall. So that's the reason why. If you have cats at home or smaller animals that have food bowls near the floor, litter boxes to clean out, that's not something particularly that we want you to do for the first month post-op, because it requires bending, stooping, lifting, but also, especially with the litter box, that's kind of a dirty situation. So we want to make sure you're not exposing your wound to anything infectious. Especially at night, this is very important. If you do get up to go to the restroom at night, please turn on a bedroom light and use your walker or your cane, whatever you have to use at that time, and turn on your bathroom light when you get there. So the important point here is that we have lights coming on and you are waking fully up. That reduces the risk of you stumbling and falling as you go to the bathroom and come on back. Some special equipment that you're going to need. You will definitely need a walker with 2 wheels on the front, not the type with 4 wheels and a seat. As you get better with your walking device, we'll transfer from the walker to a single point cane. As your walking improves, we'll transition off of that cane. The other item that's very helpful is to have is a reacher grabber device to help retrieve small items off the floor that maybe you've dropped. We really don't want you to try to bend over and grab anything off the floor until you're walking normally without your assistive device. Regarding the toilets, if you have tall toilets at home, you may or may not need a toilet seat or safety handles for the toilet. It also depends on how tall you are. So for example, if you have standard toilets in your house and you are probably 5'6" or above, you probably would benefit from some safety handles for the toilet, which are basically arms for the toilet. You can Google that and find them in many places around your area. If you're fairly tall, maybe 5'9" or above, and you have a standard toilet, you're probably going to need something a little higher to add to your toilet. So an elevated toilet seat with handles, if preferably, will help you stand up and sit down safely for your knee. If you have a tub shower type of unit, you may need a little transfer board. That is something you can purchase, and you sit down on the board and you slide over across the top of the opening of the tub, and you can carefully move your leg in and out of the tub and stand to shower if you need to. The last three items there, the sock donner, the shoe horn, and the long-handled shower sponge, those are particularly handy if you live by yourself. If you live by yourself, then you're going to need some way of putting on your socks if it's wintertime. And the sock donner is very useful for that. If you have somebody helping you after surgery, then you're not going to need that equipment. The car handle assist, that is very useful to hold on to getting in and out of your car. If you Google that, you'll see a picture of it. In fact, if you Google any of these items, you can see a picture of it and find a convenient place to purchase these items. We also have a DME, which is a durable medical equipment shop here at Forte, up on the third floor, just outside the physician's office. So if you need any equipment, you can go there to purchase that as well. On the day of surgery, you need to carry in a few items with you. Actually bring them into the building. Please bring your walker in with you as you will use it that day before you go home. Please bring your ID and insurance card. If you're going to have home health physical therapy, that means the physical therapist coming to your home, that agency will call you the day of surgery to decide what time to come see you the day after you get home. So please bring your cell phone, as they will be calling that. If you don't recognize the number and you want to let it go to voicemail, that agency will always leave you a voicemail. So please check your voicemails and return their phone call. Also, wear in or bring in some loose, comfortable clothing for your lower extremity. Your knee will be swollen and you'll have some post-op dressings on that knee. So you don't really want anything tight or snug on it as for the ride home. If you're a patient of Dr. Herr, he wants you to bring in your elevation wedge pillow or the elevation pillow that you're going to use sleeping at night. If you happen to have that at home, please bring it with you. If you have arranged with our DME staff that they're going to just bring that to you on the day of surgery, then there's no need to have to carry it in. If you wear or use a CPAP or a BiPAP machine at night, please be sure to bring that with you and give it to the nurses as you come in. And if there's any chance that you'll be staying overnight, please pack an overnight bag with items you'll need. Any medications that you have to take the next day, please include that. You can leave it in the car if you'd like, unless you're sure you're going to be staying overnight. On the day of surgery, when you're back into your private room, a few hours after you return there, an inpatient physical therapist will come in and start doing some exercises with you. This is a list of those exercises. They're very simple. The therapist will give you a full handout with details on how to do the exercises, how many repetitions, and how many times a day that you're to do these at home. I'll let you take a look at those exercises. They will teach those to you. You're more than welcome to practice these a little bit before surgery. But again, if you're not sure, you'll learn them the day of surgery. The biggest reason we do these exercises is to help improve circulation, to reduce the risk of blood clots forming in either leg, and also to help reduce pain and some swelling. Please avoid pushing into pain when doing these exercises. These exercises should feel good to do. You don't want to cause pain with these. All right, the little tag at the bottom here is called gentle motions lotion. Try to remember that. Aggressive motion can create more pain and swelling, but if you do it nice and gently, it's going to feel pretty good to do and can be one of the things you do to help reduce pain and swelling. You'll also practice walking in the hallway with your walker and practice going up and down stairs that day in the hospital. When you're navigating stairs, they'll teach you to ascend or go up the stairs, leading with your non-surgical leg. And when you come down the stairs, you will always lead with your surgical leg. And of course, hanging on to the rail if there's one available. Sitting and standing can sometimes be a little tricky after a knee surgery because you may not want to put much weight on the leg, or you may not be able to bend your knee very far. So we always want to provide a very stable base of support when you're standing up and also when you're sitting down. So please try to keep your feet and knees what we call a wide base of support. So that means keep them about shoulder width apart and a little turn out of your feet. That helps provide more stability. Your surgical knee may not want to bend very far, so it's not uncommon to have the foot of that leg forward a little bit to take some pressure off your knee. You can place as much weight on your new knee as is comfortable. Let your knee be the guide. When you stand up, always use both arms and hands to push up from a seated position to stand up. So if you're sitting on the toilet, the chair, the bed, you want to place your hands there and push off that surface to stand up to the walker. Likewise, when you sit down, you're going to remove your hands from the walker, look and reach back to the surface you're sitting on, and use your arms to help guide your way down. Try not to plop, as that can really cause knee pain. Most of all, please do not pull on your walker when you're standing up or sitting down, because the walker can tip. If you're using your walker to walk to the car, you want to use the same method. The day after you get home, for most patients, the home health physical therapist will come to your house. For total knee patients, they are generally there 2 weeks. They will see you 2 to 3 times a week. And therapy care will focus on you learning to walk with a normal walking pattern, using your walker at first. And as that walking pattern improves and you're putting more weight on it, we'll transition to a cane and then eventually progress off of that cane. Your very first goal is to learn to walk without limping, without an assisted device, at somewhere between 4 to 6 weeks after surgery. Additionally, the therapist is going to do some simple exercises with you that enhance your strength for walking and tolerance in your home. They'll be monitoring the waterproof dressing in your surrounding skin to check for signs and symptoms of infection. They're going to practice with you walking safely on stairs, if you have stairs. If your bedroom happens to be on another floor other than the main floor of your house, you are allowed 1 trip a day to go to your bedroom. That means go up at night, sleep, in the morning, wake up, get dressed, come on down to the main floor for the rest of the day where everybody is and that can help you with things. You'll also be learning how to safely get in and out of the car, the bathtub for showering, those types of functional movements. And most importantly, they will teach you 2 very important knee motion exercises. One is called a sit and scoot. That's to work on bending your knee, or what we call flexion, knee flexion. And the other one is called a sit and lean. And that is to keep your knee extension, or your ability to keep it straight. If you are a patient that is not going to have home health, in other words, you're going to start with outpatient physical therapy 2 or 3 days after surgery, you'll want to make sure that you start your sit and scoot exercise on your own, but do it gently. When you get to the outpatient physical therapy, they can give you further instruction as well. A little bit about wound care. It's pretty simple and straightforward. Your skin incision is glued, not stapled or not sutured, and it's covered with a waterproof dressing. Now, there's a little picture of a long Band-Aid. It's generally, depending on the doctor, it may be anywhere between 8 and maybe 11 inches long, but it is waterproof and it'll be on your knee over your incision when you wake up from surgery. It is okay to get it wet in the shower. When you feel comfortable enough, good enough to stand to take a shower, and you want to do that, you can go ahead and let the soap and water just run over the Band-Aid and gently pat it dry, get dressed, and be about your day. Dr. Condit's patients, however, when they wake up from surgery, they will have gauze pads and a big ACE wrap all the way around their knee to provide a little more compression. That gauze and ACE wrap is removed the next day, and you will put the Band-Aid on your knee. You will go home with discharge instructions on how to do that. It's very simple, and you will be able to do that pretty easily. Regardless of when the Band-Aid goes on, it does come off in about 7 days. So check your discharge folder for the exact date to take it off. When you do take it off, please take it off slowly, gently, and you'll notice that your skin is glued together and you shouldn't have anything oozing out of it or bleeding out of it because it should be sealed off with the glue. Because it's sealed off with the glue, it is okay to continue showering and let the soap and water run over the incision. Please don't scrub on the incision as it might open up the wound. If your skin is a little dry around the incision, it's okay to put lotion on the skin around the incision, but please don't put any ointments or salve or vitamin E or lotion on an open incision to prevent infection. If you're in doubt, please call your surgeon when you can start putting anything on your incision or your scar, or check with your therapist. If there's any bleeding issues from the day of surgery moving forward, that's an immediate call to your physician. So please call them. In general, wound healing times are as follows, and this is true for anybody of any age for the most part. Our skin usually takes us about 4 to 5 weeks to fully heal and form a scar. You will have some internal sutures, mostly located on the inside of your leg, your knee, okay? Those internal sutures will dissolve and heal and form a scar, but it takes a good 2 months for that to occur and to heal. Your new joint, the bone, your femur bone and your tibia bone has to grow into the base of that prosthetic device to be 100% stable. And that takes a good 3 months. By that time, by about that 3-month period of time, you're back to doing normal, lighter household activities, moving around the community fairly comfortably and pain-free. If you overdo it, your knee will still talk to you at that time. And honestly, it takes about 5 to 6 months after surgery before you can do everything and your knee not talk to you. In the meantime, if you're being a little active, your knee will let you know. So my best advice is listen to your new knee joint. And when it's asking you to take a rest, please do so. If you've been sitting too long, it may say get up and move. So that's what you want to do. So this is a very important slide. It's about immediate post-operative goals. All right, there are 2 major goals right off the bat that we focus on with you in therapy. So if you look halfway down the slide here, your first rehab goal is to get you walking without limping through your knee as you transition from the walker to the cane and then no device, somewhere in that 4 to 6 week period after surgery. Some of you who may be younger and healthier having a total knee, you might be there in 3 weeks. That's fine. As long as you're not limping, we can transition off your assisted devices. The second big goal is to attain or achieve all your knee flexion as much as possible by the 2-month mark, the 8 weeks post-op. It is very difficult to gain more knee flexion, which is the knee bending, after about 10 weeks of surgery. The reason is the knee has healed, it has scarred in, and that scar is very, very tough and very unyielding. So we have relatively a short period of time to get your motion, about 2 months, 10 weeks. The more motion you get, that affects goal number 1. All right, the better your motion, the better your mobility. Now, the keystone to improving your motion so that your mobility improves is really reducing and controlling your swelling and your pain starting immediately the day of surgery or the day after surgery. This is critical for optimal rehab progression, restoring motion, and overall mobility for daily living activities. What we would consider pain levels to tolerable and controllable levels is if you on your 0 to 10 pain level, 5 is considered kind of a moderate pain level. If you can keep those pain levels as you're doing your exercises, your daily activities, and you're resting as you recover, keep them below that 5, that's considered controlled pain. Pain that starts to increase above a 5, gets to 6 to 7, and everything you're doing is it's just not working. We consider that uncontrolled pain. We have some strategies to help with that we'll talk about in just a minute. So keep in mind, controlled pain is 5 and below. Your activity levels are going to be modified for about maybe 6 to 8 weeks, depending on that type of activity. So we can help combat increased swelling and pain so we don't lose motion along the way. So here are some strategies to help reduce your pain and swelling. Gently do the exercises that you learned on the day of surgery in the hospital. They do help kind of take the edge off the pain and stiffness, and they also help to promote swelling reduction. Lightly rubbing the area with an open hand everywhere except the incision, don't rub directly on your incision, that can help reduce soreness and swelling as well. Please don't use a massage stick or a massage gun at this point in time. During the day, we need you to get up and take a walk with your assistive device around the house for 5 to 10 minutes every hour you're awake during the day, not at night. This is one of the best things you can do to help reduce your risk of blood clots, or DVTs, which are called deep vein thrombosis. Also, when you're at rest during the day, we prefer you to keep your legs elevated up on the couch or in the recliner, just to help control the swelling in your lower legs, ankle, and feet. As you're in that position, you'll want to change knee positions a little bit as follows. So pick a pillow and place it underneath your knee to allow it to bend, and let it rest there for about 20 minutes. Then remove the pillow and allow the knee to lay straight or flat for 20 minutes. Keep alternating this throughout your day. At night, it's a different situation, so we'll do something different at night. But during the day, we want your knee to go flat or extended, about 20 minutes. Now that doesn't feel really good. So if you want to do a gentle little knee slide or heel slide to bend your knee gently, during that time, you can do a couple of those, then put your leg down flat again. Then put a pillow underneath it for 20 minutes. What this does is it keeps your knee from getting too stiff in any position so that we don't lose your motion and we continue progressing with your walking pattern well. One of the most effective things you can do is the use of cold therapy. It doesn't matter what device you're using. It could be as simple as ice packs. You might be using some of the more automated ice machines that kind of circulate the water. Some circulate constantly, some circulate on timers. They can be on and off. Whichever you use, the idea is to ice your knee for 20 to 30 minutes at a time. 30 minutes is your maximum ice treatment time. Leave it off, take the ice off for about an hour, and then place it back on. So you're going to use it a lot throughout the day, but you're going to take some breaks to allow that knee to come to room temperature. This way we don't cause any kind of frostbite issue or skin irritation by having it on constantly. You can use it at night, but also make sure that you use maybe a hand towel between your skin and the device, especially if it's one that circulates all the time. Even during the day, you'll use a cloth barrier between your skin and the ice device. It could be your sweatpants, it could be a towel, but make sure, or a pillowcase, just make sure there's something there. Try not to, please do not put the ice directly on your skin. Last one's on pain medications. I won't go into too much detail here because the nurses will give you a lot of details on your post-op medications. But in general, most people will be taking Tylenol for pain. And then your narcotic pain medication is there as your safety net. So if your gentle motions, the light rubbing, the walking for short 5 to 10 minutes every hour during the day, keeping your legs elevated and changing positions, the use of your ice, if you're doing all that and your pain is starting to become in the uncontrolled range, i.e. it's creeping above that 5 out of 10, and these strategies 1 through 5 are not helping, you can take your narcotic pain medication to help knock that pain level back down to more controllable levels, and then continue using items 1 through 5 to help control it again. Right? Your knee will tell you when you need to take it, when you don't need to take it. So if your pain's uncontrolled, please use it. If you've got your pain well controlled with items 1 through 5, you don't necessarily need to take your pain medication, your narcotic pain medication, I should say. So the key point here is immediately reduce. We want to work on reducing your swelling and your pain, because those are the keys to improving knee motion and eventually knee mobility. And it also aids with sleeping comfortably at night. Speaking of sleeping, these are the sleeping positions that we would like you to follow for the first month post-op. All of our physicians will allow you to lay on your back. And let me go with that first bullet point. All the physicians will allow you to lay on your non-surgical side with pillows between your legs to help support the surgical leg. While your incision is healing, and this is important, while your incision is healing, and that takes about 4 to 5 weeks to heal, we do not want you to lay or sleep on your surgical side. So you're more than welcome to sleep on your non-surgical side. If you're a dropped or Morat patient, you can also sleep on your back, but no pillow, no wedge pillow that you see at the bottom here. He prefers that you let your leg lay flat, or if it needs a little bit of relief, you can put 1 pillow under your knee and that's it. Don't stack your legs up. However, Dr. Herr, Dr. Worth and Dr. Condit, they like their patients to use this foam leg elevation cushion that you see here in the corner. You're going to place your surgical leg in that, laying on your back. And basically what that does is it keeps your knee a little bit above the level of your heart. So it helps to reduce that swelling during the night. Lay on your back, try to use that foam wedge pillow or the foam elevation pillow as much as you can. If your back tends to get sore, it's okay to go ahead and lay on your non-surgical side then with regular pillows between your legs. Once home health therapy has finished, which is generally about 2 weeks after surgery, you'll begin coming to outpatient physical therapy. Now, we usually will see you twice a week for the first 4 to 5 weeks. And as things get better, we'll cut that down to once a week. And the total time that we may see you in physical therapy kind of depends upon what kind of activity you want to get back into. So it can be as long as 2 to 4 months. So if you're somebody who, for instance, you're a farmer and you're working on and climbing on and off farm equipment, there's a certain amount of strength it requires to do that well. If you're somebody who wants to go back to weightlifting and playing pickleball and golfing, things that take a little bit more strength than the average just household activity, then we'll make sure that you're strong enough to do that. So that may take us a little longer in physical therapy to get you ready and reduce your risk of re-injury or falling for those activities. So in general, our PT goals is to resolve your swelling and pain so we can improve your motion and return to a normal walking pattern. We're going to work on leg strength, total leg strength, not just part of your leg strength, but total leg strength to help you first accomplish all your daily activities at home and maybe in the community, and then later on exercise. And we want to be able to do that without you compensating for a knee that's not moving well. We're also going to work on improving your balance to help reduce your risk of falls. And the ultimate goal is to return you to whatever activity levels you choose as your goal to return to, within limits, of course. So early on, I mentioned 2 exercises that the home health physical therapist is going to start you doing, and these are specific to gaining your motion. Remember, we have a short window of time, 8 to 10 weeks, to gain your motion. And these are the 2 exercises. This is the sit and scoot, which works on bending or flexing your knee. That's called knee flexion. And on the next slide, we'll visit the sit and lean to get it straight. So as you look at your slide here, the picture on your left is your start position. So you're going to sit in a firm chair. It does not have to have handles. It's nice if it does, but it doesn't require handles. And you're going to sit in that chair with your leg comfortably in front of you. Your foot tends to be pointing up, but just let it relax. Don't hold it up. And so the first move is to gently slowly slide your foot back to a point where your knee tells you it's starting to get tight. And that's your cue to stop sliding your foot and let your foot rest on the ground. We're going to keep the foot on the ground and very slowly scoot those hips forward to gently bend that knee till your knee registers about a 3 out of 10 on your pain scale. That is an uncomfortable level, not a painful level, but it's uncomfortable and you feel it stretching through the knee. When you get to that point as you move, you then want to stop progressing, stop scooting. Okay. You will hold your knee in that position where you're feeling that kind of 3 out of 10 pain level for about 30 seconds. Dr. Herr likes his patients to hold for 10 relaxing regular breaths. It happens to be about the same amount of time. So we'll hold that position for 30 seconds while it's stretching your knee, or 10 regular breaths. When you're finished, we will scoot your hips back to release the tension on your knee and then let your legs slide back out straight. We're going to do 5 repetitions of a sit and scoot. We'll also do 5 repetitions of the sit and lean, which is next. But you need to alternate doing these exercises. So you'll do 1 rep of the sit and scoot, and then you'll do a rep of the sit and lean. And then you'll come back and do your 2nd rep of the sit and scoot and do a 2nd rep of the sit and lean. And you'll continue that till you've got 5 reps of each one. And we will do that 3 times a day. It's important to push to a point where it's a little uncomfortable so we can make gains in your knee flexion. But what's really important is not to push through hard pain, because that can result in either opening up an incision or creating so much swelling that next day that you've lost motion. And that's kind of a red flag. We don't want to lose that motion that you gain. Your home health therapist is the person that's going to come to you the next day, and they're going to start these with you. And you'll continue these as you move through outpatient. So you'll probably be doing these exercises to gain motion for 3, maybe 4 weeks at the most. Some of Dr. Condit's patients may not elect to do home health physical therapy, and that's fine. If you're not doing home health physical therapy, you will need to start doing this exercise on your own at home the day after surgery, after your gauze bandages are off and you've put your regular wound dressing on. I would say err on the side of being a little gentle at first, and then you can double check that with the therapist in the outpatient physical therapy setting. So that's the sit and scoot to bend your knee. The next one is called a sit and lean to straighten your knee. This works on extension, which you need to have as well, so you don't limp when you're walking. So again, the position that he is sitting in on the left side is the start position. Notice he's come out to the front part of his seat so that he can allow his leg to rest in a straight position. Your toes up, but it's relaxed. I wouldn't hold your toe up, just let it relax. Hands are kind of resting on the top of your thigh a little bit. Don't put your hands anywhere near your knee or your incision. And that's your start position. To get the stretch, you're going to lean forward, kind of bending through your hip joints. Try not to bend your spine, especially if you have any back problems. You're going to lean forward. You'll feel that stretching through the back of the knee. And when you get to that 3 out of 10 discomfort level, that's when you stop leaning. Hold the position for 30 seconds. Or again, if you're a Dr. Herr patient, hold for 10 relaxing breaths. It is important for both these exercises that you do relax and breathe while the holding. Try not to have your leg tense and fight it. After you're done holding, sit back, take the pressure off your leg, reposition to do a sit and scoot to bend the knee that we just talked about. And then again, you're going to alternate doing these reps of exercises, 5 reps each, 3 times a day. Now, in terms of how do you know if you're making appropriate gain motion in a timely manner? This top half of the slide goes through the timeline measurements so that I know as your therapist that you're going to meet your final range of motion capacity at that 8-week mark. So on the day of surgery, you'll be able to let your knee rest flat, or in other words, a fully extended position on the bed. So we just got to make sure that you can always continue to do that. That is not quite as hard and doesn't take as long to gain your flexion motion or the bend motion. On day 14, you have to be able to bend your knee to 90 degrees or we're behind schedule a little bit. If that's the case, then your therapist will rework or figure out what's going on and we'll address that. To be honest with you, most patients are reaching their 90-degree bend before day 14. And that's great. They're not forcing anything. At 1 month, we have to have at least 100 degrees of knee flexion, or we're considered a little behind schedule. And by that 8 to 10 week mark, we need a minimum of 120. And for some of you, that might be our optimal position. But most patients can gain a little bit more than that. So hopefully, ideally, we want to try to maybe shoot more of that 125 to 130. Some patients who have much thinner legs and not a lot of muscle mass or mass there may get to 135 degrees. It kind of all depends on what your other knee looks like. Your healthy knee, it's healthy. So if you have a non-arthritic knee and that knee can bend to 130 degrees, we're hoping that your surgical knee can reach the same measurement. So those are some of the timelines that we have. And that's kind of what we go for as a therapist with you. Now you can see why it's very, very important to reduce and control your pain and swelling early on to help gain these motions. And as you progress with your activities, as we progress with therapeutic activities and rehab, as you're progressing with your just daily activities at home, you're constantly paying attention to your knee and watching how it responds to those increased activities. If it's responding with an increase in swelling that limits your motion or you lose motion the next day, that's a red flag. So we've got to spend that day or two, whatever it takes, to get your swelling back down and regain that motion right away. All right. Strength is something we can always catch up with later, but motion is not. And again, just don't exceed that 3 out of 4 out of 10 on your pain scale. Don't go beyond that 3 out of 4 with any activity, exercise or daily activity for 6 to 8 weeks so that we can control, again, your swelling. If you push really hard, you do run the risk of disrupting the incisions. And also, again, that may be causing more uncontrolled swelling and pain that's regresses your motion gains. Just some criteria for returning to driving. The 2 red ones are very important, and those are the critical ones. First of all, you got to be off your narcotics. And I'm going to speak of the narcotics that you're taking post-operatively for your knee. And also, you should be able to comfortably get in and out of your car. If you're still using a walker, you probably should not be driving. All right. Also, with regards to braking, most people brake with their right, but we still have some people that brake left-footed. So it's really not a right or left criteria. It's more what leg you brake with. You've got to be able to have good reaction time and slam on the brake to make a hard, sudden stop to avoid hitting somebody or something. Those are the those are the 2 criteria that are vital to go back to safe driving. Usually the braking leg after a total knee is somewhere around 3 to 4 weeks before most people are comfortable doing that. Occasionally, if I have somebody that is really young, so maybe you're in your late 30s having a total knee and you've been working out and you're really strong already before surgery, you might be able to brake 2.5 weeks after surgery comfortably. It very much depends on those types of situations. Just talking about some activity modifications. Take it easy after surgery. Don't be in a hurry. Be patient with your knee. Your knee has to heal. And to allow it to heal, you need to be patient with it. Respect the boundaries of the healing timelines and what your knee is comfortable doing. Learn to do self-care tasks, definitely. Getting yourself dressed, eventually enough motion in your knee to get your own shoes and socks on, being able to walk without a walking device. Those are all self-care tasks. But for the first month, please don't feel that you're going to be the person standing to do all the household chores or the cooking or the laundry. That is not you. Somebody needs to help you with that. To reduce your risk of falling, please limit your stair walking to 1 time a day, as we mentioned earlier, if your bedroom's on a different floor. And sometimes that has to do with the safety concerns regarding the side effects of pain medication if you're taking them. Don't carry anything with you up and down the stairs in hands for at least a month. I really want your hands on the rail. And no, those first couple of weeks, no standing prolonged standing to prep meals, do laundry, household chores, go grocery shopping. And please don't go walking for exercise if you have not cleared that with your physical therapist. Again, everything we do in progressing your rehab, progressing your daily activities is done in small, gradual progressions so your knee can tolerate that well without regressing. More activity notes here. Somewhere around the 6 to 8 week mark, that's about the time your motion is coming back. Your swelling is well controlled. Your pain should be well controlled. You're advancing with, doing a little more around the house. You're going to feel a whole lot better than you did pre-op. You may have some intermittent soreness or swelling from activity as you progress and increase in pain as you're progressing with activities. That's not unusual, but it should be pretty mild and should be able to resolve by the next day so that, again, you're not losing motion. Sometimes patients will say, they're 6 weeks out and for the last 2 weeks, they have slept like babies. They've had no knee pain. And suddenly the following week, their knee's waking them up at night because it hurts. That is your knee talking to you and telling you that you're overdoing it during the day a little bit. That's what's causing that, most likely. So the idea then is to back off how much you're doing, or maybe take a few more breaks during the day, or maybe go back to icing a couple more times during the day, just to help that pain go away so that you can sleep again pain-free at night, and then progress again. The rehab program includes gradual increasing in walking with your assist devices to improve mobility initially, and then in your home, and then later out in the community. And of course, we want to get you off your assisted devices to walk normally. We want you to be able to resume other normal household activities requiring longer periods of time of sitting, standing, walking, eventually being able to carry a bag of groceries into the house without your knee hurting, just some gentle lifting of small items, and then climbing stairs comfortably with a normal step over step gait pattern. And then also we will provide with specific exercises to help restore movement. We've talked about two of those already, the sit and scoot and the sit and lean. We'll implement some balance activities to help reduce your risk of falls as you get progressing with your rehab and back to normal living. And of course, strength and endurance is always important to improve so that you ultimately can return to an active lifestyle. So here's some activities that are considered realistic to do and easily to do and won't harm your knee. Those are on the left side. The right side are some of the higher impact activities. So the reason we don't want you to do regular high impact activities like running, jumping, jogging, or really heavy weightlifting is twofold. One, it can cause the prosthetic device to loosen, become loose. And you'll notice that doesn't feel good. And then the other thing is the bone that it sits in, if there's a lot of high impact repetitive activity, can cause stress fractures in that bone, which then causes the prosthetic device to loosen. And so those are two things we really, really want to avoid. So on the left side are more realistic examples of activities. If you just want to walk for exercise, it could be power walking even. It could start with a half mile. And if your goal is to walk 5 miles a day, it will take us some time to get you there, but that is a doable goal. Swimming or water aerobics, things like golfing, doubles tennis and pickleball, those things we can get you back to, but those are a little more vigorous to the knee. So we will do a lot of strengthening, endurance, balance training, so that when you hit that 10 to 12 week mark, we can start introducing a game type of activity like golf. That's a lot of rotation on a swing. So we kind of don't introduce that and let you do that until we're about 10 to 12 weeks out of surgery for the most part. And sports that require a lot of cutting, agility work, we kind of get you ready for that. So around that 3-month mark, assuming your motion's good, your pain is down, daily activities and normal living are good, we can progress you back into those sports, okay? One comment about the high impact activities like running, jumping, hopping, that type of thing, crawling even on your knee. If you're in harm's way or someone is in harm's way and you need to go help them and you need to run to get there or kneel and squat and hop over something to get there, please do that. That one-time activity of doing that will not harm your knee. It's the repetitiveness of the high impact exercise that can cause damage. So, in conclusion, I would like to thank you very much for your time today, for your attention today, and listening to what we have to share with you. The entire Forte staff, our physician staff, our physical therapy staff, we want to say thank you for letting us take you through your journey. And together we're going to return you to a very active lifestyle. Just a little footnote here. Most of you, not all of you, but most of you will need to go through what we call a prehab physical therapy appointment. This is an appointment that you have with a physical therapist prior to surgery. And it can be anywhere between 1 and 2 or 3 weeks, 4 weeks prior to surgery. We usually do that in conjunction with your pre-assessment testing visit that you have here at Franciscan. But this is about a 35-minute visit, this prehab visit. And we're going to focus on a short physical exam of your knee, followed by more detailed instruction on specific equipment that you need, review your rehab goals, teach you how to safely transfer sitting, standing with your walker. We'll do a quick review of sleeping positions. And then the very important thing is we will make sure that you correctly can perform the sit and scoot and sit and lean range of motion exercises. So we'll make sure we teach those to you. So again, thank you very much for your attention, and we look forward to seeing you at your prehab visit.